Now let me give you all a brief introduction of our distinguished speaker, Dr. Arora. So after graduating medical school and foundation training in Birmingham in UK, Dr. Aman Arora completed GP training and attained MRCGP in 2010. Since then, he has held a variety of clinical and educational roles, completed the postgraduate certificate in medical education at the University of Dundee, and received fellowship of the Royal College of General Practitioners in 2017. He now focuses full-time on improving medical education for doctors across the world through the Arora medical education platform. He continues to deliver talks and teaching sessions at conferences, both in the UK and globally, focusing mainly on the PLAB, MSRA, and MRCGP exams, as well as medical careers in the UK. Previous roles of Dr. Arora include GMC PLAB 2 examiner, GP recruitment examiner and question writer, HEWM IMG board member, GP training program director, HEWM advanced MRCGP AKT trainer, NHS GP appraiser. He's also passionate about maximizing mindset and making sure doctors are in the best headspace to tackle exams. He trained to become a certified meditation trainer and regularly help doctors reduce stress and burnout through teaching simple meditation techniques at workshops and conferences. So without any further ado, I yield the floor to Dr. Aman Arora.
Thank you so much. Thank you guys to everybody who's attending. Let me just share the screen. So yeah, firstly, thank you to everyone who's organized this event. I think it's a really good type of event for you guys, and understanding, foreign systems and exams that may be coming somewhere in your pathway, I think is a really good thing to think about in medical school. I often see medical students not really focus on the next stage of their career until quite late, and then there's a bit of a panic once they've got through finals and they realize that I've got to start making some major decisions soon. So it's really good that you guys are attending and understanding possibly different pathways and looking ahead in terms of preparation for those exams. So yeah, really honored to be invited to this. I've seen some of the lists of other talks that have been happening with you guys, and it looks like a great platform. So thank you once again for inviting me. I know that you guys had a talk yesterday with Dr. Kimberly, who's another fantastic doctor in the UK who does a lot of work for IMG doctors. So I think you understand the process of the general pathways to the UK. So my focus today is going to be on the exams that allow you to go through that pathway in the UK. So what we're going to try and cover today is what are the PLAB exams, and what's the difference between PLAB 1 and PLAB 2, and how do you prepare, and what's the process of passing these exams. We're going to talk a bit about UKMLA, which is the future of licensing exams in the UK. So that's something that we'll touch on in a bit of detail. We'll look at how to prepare for currently the PLAB 1 and the PLAB 2, because those are the immediate exams in the future if you're doing any of these in the next probably year and a half. Why technique is so important for PLAB exams and UKMLA, what are the kind of things that are being assessed of you, and therefore how can technique help in get a good score. And then we'll look at a little bit about some resources available for the PLAB exams, and then do a bit of Q&A as we go through. Like was mentioned at the beginning, I'm quite happy for questions to be fired at me throughout. If it's a quick question, I can quickly answer it as we go. Otherwise, I'll look at the end to make sure I try and cover everything, because this is your session and I want you guys to ask your questions. It's sometimes a little bit difficult to design talks around these types of things because people have individual questions. So please do try and make it your own by asking any questions that you have, and I'll try and answer them to the best of my ability. So thank you for the very kind introduction earlier on. I think you pretty much covered everything and in an amazing way. So thank you so much for that. Yes, I'm a portfolio GP in the UK. I have been a GP for a while, but now I'm focused fully on medical education. And like was mentioned in the introduction, yes, we help people get through exams and we help people clear exams. That's kind of a prime role of what we do. But another major area of what we do is trying to allow doctors to reach their full potential in the NHS. And there's been a lot of challenges for international medical graduate doctors coming to the UK recently. And one thing we do, apart from trying to help through the exams, is to deliver conferences and workshops and networking events for international medical graduate doctors to allow them to not only thrive in their clinical career, but also to thrive in the UK in general as well. So a big part of what we do is not just the exam side, but like we said, trying to help you through all stages and all steps and all queries that may come across from a doctor who moves from abroad to the UK. And we understand it's a huge deal to to move countries, and start to set up careers in a different country where you may not know anything about the health system, how it all works. So we understand it's a very big step to take, and we hope to try and help you in various stages. I'm lucky to be a GMC PLAB 2 examiner in the past. I've seen how doctors prepare and struggle at times to prepare and clear PLAB 1 and PLAB 2. So hopefully these kind of sessions can help just increase awareness a little bit, so that if you do choose to go down the PLAB route or the UKMLA route, you have a little bit of an idea early on as to what you're kind of setting up for and letting yourselves into. So we teach not just for PLAB, we teach for medical school finals, we teach for PLAB, like we said, but also once people pass PLAB and they think about going into specialty training, and you would have heard about this no doubt yesterday with Dr. Kimberly, we do a lot of work around those exams as well. So getting into general practice training or radiology training or ophthalmology training and MSRA exams. And then we do a lot of work around MRCGP. If you end up being a GP trainee or going down the general practitioner road, and you may or may not realize, but 80, probably 90% of doctors who come to the UK, or doctors in the UK itself, will be GPs. General practice and primary care and community medicine is the bedrock of the NHS. So a lot of people who come to the UK do end up being general practitioners. So let's talk a bit about what the PLAB exam is, because this is currently what is in the system at present. The Professional and Linguistic Assessments Board exam is taken by any doctor who qualifies outside of the UK, outside of Switzerland, or outside of the EEA, so certain European countries. Anybody else who comes to the UK, whether it's from India, Pakistan, Australia, they have to take the PLAB exam. And the PLAB exam is basically designed to allow you to demonstrate that you have the appropriate skills and you have the appropriate knowledge to practice in the UK. So in essence, it's just checking that you have the kind of core basics in place to allow yourself to work on your own, independently, on a ward, for example, in the UK. They're looking to assess you at the same level as a doctor who's entering the second year of what we call the foundation year program in the UK. So in the UK, doctors go to medical school, they get their initial degree, then they enter the foundation program. The foundation program is 2 years, foundation year 1 and foundation year 2. And the PLAB exam is assessing you at that level of foundation year 2. So when you transition from FY1 to FY2, and generally after FY2, people then apply for specialty training. So they want to make sure that you're at this level. So it's a level that's slightly above where you'd expect someone who's just finished their primary medical degree. Now that's going to be slightly different for UKMLA, and we'll talk about that in a second, but this is currently where we are with PLAB. Once you clear PLAB, of course, you then get your GMC registration. Of course, there are a few other checks that are done, but once you clear your exam, in essence, you can get a license to practice in the UK. And at that stage, you can then apply for jobs, apply for specialty training, and look to further your career, depending on the path that you choose best. So 2 exams currently, PLAB 1 and PLAB 2, and we'll break those down in a bit of detail in a second. So there are some eligibility criteria for doctors to see whether they are okay to apply for PLAB in the first place. So you need to have 12 months of postgraduate clinical experience at a teaching hospital. This could be for international medical graduate, of course, going to be back home. So whenever you finish your primary medical degree, once you've done 12 months of postgrad clinical experience, then you can apply for sitting the PLAB exam. You need to have your primary medical qualification listed in the WHO directory of medical schools, and most medical schools around the world will be in this WHO directory. If medical schools aren't, then you can contact the GMC to see if it's a medical school that's accepted. Before you can think about taking the clinical part of the PLAB exam, you have to prove the English language tests are cleared. So there are 2 main English language tests, and I'm sure Dr. Kimberly talked about this yesterday. IELTS and OET are the 2 that currently the GMC allow in terms of demonstrating that the English language level is enough to be able to work in the UK. That's step 1. And then you have your PLAB exams after this. So actually a lot of people start preparing for PLAB in the later stages of medical school, and that's something that we encourage people to do, but often they find that this is the step that actually gets them the most challenge. So it's important that if you are preparing for PLAB and thinking about the PLAB route, to almost start to look into these English language assessments as well, and maybe start preparing for those alongside, because I see a lot of doctors who start preparing for PLAB and then get stuck for 2 or 3 years at the English language test. So it is something that needs some work, and it's something that needs technique and practice, just like any exam that you've done up to this point. So I'll briefly look on UKMLA now, but we'll come back to it in a bit more detail later on. UKMLA, the UK Medical Licensing Assessment, is going to replace PLAB in 2024. It was actually something that's been talked about for a number of years before 2024, but with the pandemic and other delays, it currently is set for 2024. So that can still change in theory, but we're all working towards this 2024 target. And it's an exam that's going to need to be taken not just by international medical graduates who are coming to work in the UK, it's the exam that also needs to be taken by UK medical students as well. So when they finish medical school in the UK, they will also have to take the UKMLA exam. So it's kind of a benchmark setting exam that is going to be putting all doctors, regardless of where they trained, in the same bracket to see, do you get your GMC registration? We'll talk about this in a bit more detail later on in the talk. And this will also have two parts, your AKT and your CPSA. And again, I'll cover these in a bit more detail. But in essence, you can see them as mirrors of PLAB 1 and PLAB 2. But again, we'll go into the detail in a second. So PLAB 1 is the initial part of the current system. So the PLAB exams, it can be taken at multiple centres worldwide. You don't need to come to the UK to do your PLAB 1 exam. There are probably maybe 60 or 70 centres around the world where you can take your exam there rather than travelling to the UK. So that's an advantage. There are some exams for different countries that you can only take in the actual country itself. So at least with PLAB, you get to do the first part abroad. I don't know whether UKMLA will be the same, but I presume it will because they're targeting the same cohort of doctors. 4 sittings per year. PLAB can be taken, PLAB 1 can be taken, and you have a maximum number of attempts of 4 per person. But ideally, you want to be cracking it in attempt 1 or 2. By the time you get to attempts 3 or 4, the pressure really is on, confidence really is not by then. So ideally, you want to get it done in the first attempt, and that means preparing in a smart and efficient way. The format, 180 multiple choice questions. I'll show you a couple of example type questions in a second. You do this exam in 3 hours, so approximately 1 minute per question. And all the questions in PLAB 1 are multiple choice answers, best of 5. So you get a question, 5 answers, and you're looking to see what is the most appropriate answers. In essence, you can be tested on pretty much anything that will come up, I suppose, in medical finals, anything that is across the spectrum of medicine. There is something called a PLAB GMC blueprint that you can download off the GMC, the General Medical Council website, which gives you basically a list of all the topics that you'll be tested on. But in essence, it is the whole of medicine. So it does take a bit of preparation to get through all topics to a level that you need to pass PLAB. In addition to all the clinical topics, there's a little bit of work around the ethical side of practice in the UK as well. And that's sometimes an area that people need to do a little bit of work on because it's different in every country. So it's important to be aware that it's not just the clinical side of things, there's some professional ethical types of questions as well. The pass mark for PLAB 1 varies. It's based on statistics. So every single exam that's done, there's a different pass mark that comes out, and there's lots of internal tests that are done to make sure that that represents the paper that has just happened rather than a generic pass mark that you're always aiming for every time. But approximately it's about 70%, which is in line with most kind of postgraduate exams that you might be doing in the field of medicine. Let's just give you an example of a PLAB 1 question. I'm just going to go silent for a second. Just see if you can have a bit of a think of this. If anyone wants to put the answer in the chat as to what they think might be the right answer, then please go ahead. I'll just give you a few minutes just to read this through. Okay, great. So hopefully you've had a quick read. Hopefully you've started to get a few answers. Even if it's a guess, it's absolutely fine. But the first thing to point out here is the question is talking about NICE cancer referral guidelines. So when you come to your PLAB examination, obviously you guys are training in a different country, systems might be different, guidelines might be different, local protocols may be different to national protocols. And one thing to remember when you're doing a PLAB exam or preparing for PLAB, you need to make sure that you're learning the UK guidelines, the national UK guidelines. And NICE obviously is the main set of guidelines that's currently used in the UK. You have NICE guidelines, you have NICE CKS guidelines. These are the two that most of the questions are going to refer to when it comes to guidelines. Now, I've seen lots of international medical graduate doctors in the past struggle with this because you've been learning maybe a different set of guidelines, maybe US-based guidelines or Australian-based guidelines or local guidelines to where you are currently. And it can be quite hard to kind of switch them off and switch on to a different system for the exam. But it's just an important point to remember early on that you're looking at NICE UK guidelines for the exam. And there are some topics that come up all the time, and one of the topics that's covered in this question is urgent cancer referral guidelines. So these kind of questions are what you call your high yield topics. So whenever we do our teaching for PLAB 1, we always talk about what are the high yield topics that everybody really needs to know, because these are bound to come in some way. And then what are the other ones that if you have time to go through in a bit more detail. So cancer referral guidelines in the UK are a big deal, and therefore questions like this are going to be quite frequent. Any idea what this might be? Any idea what you think the answer might be? Anybody, if you want to put a guess in the question, doesn't matter if it's right or wrong. It's just to get you thinking about the lines of what tells you that cancer is something I need to rule out quickly in this type of scenario. So we had the first answer, thank you. D has come through. And the answer is D. Well done. The answer is D. A lady with a persistent hoarse voice. You're thinking about the possibility, of course, of laryngeal carcinoma, and therefore that would be what we termed a red flag presentation. And red flags are something that you really need to know for your PLAB 1 and your PLAB 2 exams, because they'll be expecting that, you know, if a doctor is going to come and work in the UK in a few months on their own independently, are they able to pick out potential red flag symptoms that need urgent investigation? So D is the answer here. A toxic multinodular goiter is not suggestive of something like cancer, of course. You're thinking of other reasons of maybe hyperthyroidism. A man with unexplained ulceration in the oral cavity for 2 weeks. This would be yes if this was 3 weeks. So when it comes to the PLAB 1 exam, and often with MCQ exams, what our brain tends to do is sometimes look for big words. So we'll know that in the NICE cancer referral guidelines, unexplained ulceration of the oral cavity is a red flag, but this part of the statement is not correct. It needs to be for 3 weeks or more, and that's why it's not B. Strong family history of thyroid cancer. Yes, that is something that may make you think someone has a higher risk of cancer, but it's not one of the red flags in the NICE guidelines that would need an urgent referral. And then a lady with sore throat for 4 weeks is not something that features in the guidelines. So for example, when you look at your NICE cancer referral ENT, ear, nose and throat guidelines, there are 4 situations that you need to be learning for a PLAB 1 exam that would tell you that this question needs an urgent referral to rule out suspected cancer. Persistent unexplained hoarse voice, like we talked about in this question. Unexplained lump in the neck, you're thinking, of course, thyroid cancer or lymphomas possibly. Unexplained ulceration in the oral cavity for 3 weeks, like we mentioned, not 2 weeks like in the question. And then unexplained thyroid lump, because you may be needing to rule out a thyroid cancer. So that's a typical example of a question, and it just highlights the need to know the UK NICE guidelines, and particularly high yield topics like the suspected cancer referral guidelines that will come up all the time. One more example, just to show you how technique plays a big part in PLAB 1. It's not just core knowledge. There's a lot of doctors who do lots and lots and lots of work for PLAB 1 and still struggle because their technique is not sound. So I'll just give you 30 seconds to have a quick look through this. Again, if you have any ideas, please let me know of any answers. Doesn't matter if it's right or wrong. Anyone want to enter a guess? No takers. So the answer is E. Again, I'm not too worried whether you know any of this or got this or not, but it's just to highlight the kind of things that people often struggle on from a technique point of view. So this question is clearly about atrial fibrillation, a very common presentation. It's going to come up in exams like PLAB all the time. You can see it's got the NICE CKS guidelines here. So there may be lots of different guidelines when it comes to atrial fibrillation, but knowing the NICE guidelines are the ones that are important for an exam like this. From a technique point of view, you can see the word least correct here. Often what we tend to do in exams when we're doing things like PLAB 1 is a lot of people will focus on the big words. Your brain will generally tend to go for big words, and we tend to miss small words out. So a lot of people will miss the word least, for example. So their brain will see atrial fibrillation, their brain will look at NICE CKS guidelines, their brain will start to go through the answers, and then just miss the fact that you're looking for the least correct option as opposed to the most correct option. So often people get questions wrong like that. Second bit of advice is here you see a double word here, least correct. Very hard for your brain to stick to work things out with double words. So you'll start going through the answers. Is this least correct? Is this least correct? Is this least correct? Is this? And it can be quite challenging, particularly if there are negative points in the answers as well. So every time we get a double word, we teach people to change it to a single word. So rather than looking for the least correct option, look for the false option. It's much easier for your brain to look for something that's false than to look for least correct. And then again, a key point about guidelines. So E is incorrect because the guidelines changed around six to 8 months ago. It used to be that when somebody has atrial fibrillation, you are thinking about anticoagulation, and you base that decision based on 2 scoring systems, a CHADS-VASc scoring system, which is to look at someone's risk of stroke, versus a HAS-BLED scoring system, which is looking at risk of bleeding. So that used to be previous guidelines. Now this has changed. It's now an orbit score that you'd look at to assess risk of bleeding as opposed to a has bled score. But if, for example, you're preparing for PLAB 1 and you're using material or books or notes that are out of date, i.e. even back, as far as 6 months out of date, you could be getting a lot of questions wrong because of guideline changes. So whenever you come around to revising for PLAB 1, and this is important for any medical exam really, just make sure the notes that you're using are not, more than say 6 months old, because for a question to, say a guideline changes 6 months ago, that's probably enough time for a question to reach an exam, because for a question to reach a major exam like this, it takes time to get questions written, tested, stats to be done around them. So around that 6 month time is reasonable. If a guideline changed a month ago, I don't think it would feature an exam if you're doing an exam in a month's time, but go back at least 6 months when you're preparing to make sure the notes you've got are not out of sync. Other bits of technique, the word could here is important. That's a soft word. When we talk about MCQs, there's a difference between soft words and hard words, and it's really important to get your brain to almost subconsciously pick these things up, because every time you see a soft word like could or can or may, they're much more likely to be true statements, because even if it's 1 in a million, that's a true statement, as opposed to harder words like always or never. Very little is 100% in medicine. So when you do questions like this, whether it's PLAB 1 or any other medical exam that you're doing that's MCQ, trying to figure out soft versus hard words is important, because it can help you get questions right, even if you don't know the core medicine. So all the other statements are true, but E is incorrect. So it just shows you a little bit about, you've got some questions that are pure knowledge, really. You need to know the guidelines, you need to go through them and learn them, and there are systematic ways of doing that. But then there are other questions where knowledge plus technique makes a huge difference. And I think when it comes to PLAB 1, people underestimate the importance of getting your technique right. And if you're thinking about preparing for PLAB 1 from an early point, technique is also important to bear in mind. So a couple of examples there, a few key points about atrial fibrillation and why the question was right. But as you can see, all the guidelines that you need to learn are based around NICE or NICE CKS guidelines. And those are the two that I'd be looking at as a prime starting point if we're looking at revising the core topics, the chronic diseases like hypertension, asthma, angina, COPD. They've all got NICE guidelines. So it's important to try and use those when you're preparing. And then of course the orbit, as you can see here, is the score that we use, not has bled, and that's why E was the answer for that particular question. So a couple of key pointers about PLAB 1 preparation. I don't know if any of you guys are currently starting to prepare for PLAB 1 or you're thinking about PLAB 1 in the near future. We talk a lot about a dual-based approach. A very common method for practice of PLAB 1 is just to do lots and lots of questions, do lots and lots of MCQ questions through a question bank. Now, that's fine. That will give you a lot of knowledge around the questions that you've done, but no question bank, no list of questions can cover the whole syllabus. So that's a single-based approach. What we talk about is a dual-based approach, where you balance up doing questions regularly because you need that for your problem solving, but also building up knowledge and core strength in that area as well. So the way I used to do it for my own exams, I used to have a 50-50 split. So if I had an hour to work, or if I had 4 hours to work, or if I had 10 hours to work, I'd do a 50-50 split. 50% of my time will be doing questions, so I'm building up my problem solving ability, and then 50% of my time will be on knowledge building and reading guidelines, going through videos, going through courses that allow me to build my knowledge. So for PLAB 1, a dual-based approach is really important. Start with a plan. Often I see people with PLAB 1 exams just kind of jump in and do lots of questions and just hope that by the time the exam comes, they'll have somehow covered everything. That's obviously a very stressful way to prepare for exams. So whatever the exam is, having a plan, knowing what the syllabus is asking you for, having some kind of timeline in place so that you have little targets to do, really important when it comes to PLAB 1, just because of the vastness of the amount of material that you need to know. We always talk about starting where you don't want to, and this is for PLAB 1, but also for any exam. If you have a list of topics and you know there's one topic that I really don't like, whether it's women's health or cardiology, often what we tend to do is leave that till the end, don't we? Because we go for things that we like first. And one thing we always talk about is get ahead of the things that you don't like. So start with those difficult topics first. Start with the ones that you really don't want to open your book for, because the confidence that you get when you do that first topic will lead you on further on. Because if you leave it till the end, you're always thinking, I've got to do this, till I've still got to do women's health, I've still got to do genetics, and it can drag you down a little bit. So start where you don't want to go. Find your learning style. I'm sure you guys, when you've gone through your exams in medical school so far, have found your own learning style. Some people learn through watching videos, some people learn through audio, some people learn through pictures, some people learn through text. Don't follow the crowd. Don't just go with what everybody else is doing, because you have your own style. Your brain works better in certain ways than others. So if, for example, you're learning things through reading because everybody else is doing that, but your brain learns 5 times quicker through video, if you stick with the reading approach, then you're not really being smart in your preparation. And when it comes to PLAB 1, because there is so much material to learn, if you don't understand your learning style early, then you're going to probably be not very efficient in the way that you're preparing. So this is a really important tip to think about. Find your learning style early on, and hopefully you guys will already know a little bit about that, given that you've done quite a few tests and assessments already, I'm sure. Passive learning, this is where we talk a lot about making sure you learn on a day-to-day basis without even almost trying to learn. You know, in the old days, I would say people used to set aside an hour and open the books, and that was their hour of revision. The rest of the day, they didn't really think about preparing for exams. Whereas nowadays, with social media, with a lot of passive learning going around, really important to just try and learn little snippets here and there as you go throughout the day. So we do a lot of teaching on social media. We do a lot of color-based teaching, image-based teaching, short, snappy videos, because when you're scrolling through social media, the last thing you want to do is scroll to learn. But if you're learning something as you're scrolling, it's a really big advantage, because your passive learning is increasing significantly, and that will reduce the need to do a lot of active learning when you sit down to do it later on in the day, for example. And also passive learning comes from, you know, seeing patients, going to clinics, for example. When don't just kind of sit there and see a condition that you've never really heard of and then just forget about it. Go and read that condition up, because that's all passive learning. You quickly get out your phone, have a look at it online, see a few key things to learn about it, and then move on. All that will build your knowledge base throughout the day, so that when it comes around to preparing, you don't feel like you've got such a big amount to do. People, like I said, tend to get a question bank and practice lots of questions when it comes to PLAB 1. So I often get asked the question, what is the best question bank? And this might be the same for the exams that you guys do as well. What's the best source of questions to do? And we always talk about, look, there is no best or worst question bank. People have to find the source or the type of question that suits them best. But what we do mention when it comes to doing questions and MCQ practice is to make sure you don't just rely on one source of questions, because generally, if you rely on one source of questions, whichever that source is, your brain will start to get very used to the style of writing questions from that source. So you almost start to be able to answer questions because you know how this source writes questions. And then when you get to an exam that's written by different writers, obviously, then your brain can get a little bit stumped if you're so used to one style. So there is no best question bank. It's just about making sure you don't have one single source, have at least 2 sources of questions, so that your brain is not getting stuck on one particular style. We've talked about guidelines, very important to know all the UK major guidelines when it comes to PLAB 1, and also we've talked about how the importance of going back to check that guidelines haven't changed in the last 6 months or so before you sit down and learn a whole major guideline. And finally, for PLAB 1, what I say is take the advantage of peer support. There's a lot of social media groups around PLAB 1. People often find study groups around PLAB 1. I'm sure you guys do it for your medical school exams. And you know that when you're trying to prepare for something as big as this on your own, it can be quite lonely, it can be quite demoralizing, motivation can go down. So having a peer support group, doesn't have to be many people, maybe 4 or 5 people, just pushing yourselves along, because accountability to yourself is one thing, but accountability to somebody else is something else. If everybody's planned that we're going to do ENT by next week, you're more likely to do it than if you just say, I plan to do ENT by next week. So having that peer support is important when it comes to something like a PLAB 1 exam, again, because there's so much to learn and it can be a little bit demoralizing. Now, before I jump onto PLAB 2, any queries, questions about the PLAB 1 exam, anything that we've covered so far, or does that all kind of make a bit of sense? Are there any prep courses for PLAB 1? Yeah, there are quite a few. There are lots of question banks where there are just sources of questions. There are not many preparation courses out there, but we will talk about ones that we provide later on, because we do a gold package which covers a lot of different things, and I'll talk about that shortly at the end of the presentation. So there are courses, but less than courses, you mainly find question banks, because lots of people tend to prepare from questions. It's important to bear that in mind. If there are no other questions, then I'll jump into PLAB 2, because PLAB 2 is the one that people often fear most. PLAB 1 is something that you can kind of sit there, do the work, do the exam, and clear it, whereas PLAB 2 is the one that often people are quite fearful about. So PLAB 1 is the MCQ exam that you have to do, that you can do in various places around the world. PLAB 2 is the OSCE exam that you have to come to the UK to take. So objective restricted clinical exam, I'm sure you've done OSCE exams in medical school already, but it has to be taken in the UK, and you essentially have to go around a circuit of 16 different scenarios, and in each scenario there may be a role player or a patient, there may be a mannequin that you can do examinations for, it may be a telephone situation where you're speaking to a patient on the phone, it may be a home visit scenario where you're seeing somebody in their own home environment, but it's set up to look like a home environment. But essentially you're going around a circuit of 16 stations, and each station has 8 minutes to assess various things, and you have a 1.5 minute break between each station. So you basically rotate around. Currently, the exam is taken in Manchester in the UK. So if you are going to take the PLAB exam, you have to kind of factor in the fact that for PLAB 2, you'll need to be coming to the UK in advance. So things like visas, etc., all need to be sorted out, and time needs to be given for those things. The whole exam takes around 3 hours. It's quite a long exam. It's a tiring exam, but it's, it tends to fly by when you're in the adrenaline of doing an exam like this. Examiners are usually in the room, so they're watching what happens and marking you as and when it happens, but sometimes examiners are watching or listening remotely, either through video link, or if it's a telephone consultation you're doing, then listening on the other end of the phone, for example. But generally examiners are in the room with you, and for each station that you do, you're assessed in 3 different domains. You're assessed in your data gathering skills, and we'll go through these in a bit more detail in a second, your data gathering skills, your clinical management skills, and your interpersonal skills. So you get a score for each of these 3 for each of the cases that you do, and you end it with an overall score. To pass PLAB 2, you need to achieve 2 things. You need to achieve the pass mark in terms of the total score for that day. And similarly to PLAB 1, the passing score will vary based on statistics for that day. But secondly, you also need to pass a certain number of stations as well. So you need to make sure both things are ticked off to pass PLAB 2. And I often see doctors who will get the overall score, but they won't pass enough stations, or they'll pass a certain number of stations, but they won't get the overall score. So it's a balance of making sure you try and get both achievements. And we don't know whether that will be the same system for the UKMLA yet. They haven't given that information, but I presume it'll be something similar when UKMLA comes about. So an example of a PLAB 2 station, you might get a scenario given to you that you read outside the station. You have a minute and a half, like we mentioned, to read a station. So for example, you get a bit of a background history. 32-year-old male is annoyed as he has missed a dose of antibiotic this morning. This is an inpatient. He's been an inpatient in hospital for 3 days with pneumonia that has been improving with treatment. He's due to be discharged home tomorrow. The delay for the antibiotics was an hour, and it was due to another patient on the ward becoming ill or unwell very quickly. So this is an example of a scenario that you've been given, and then you would walk into the room and you would do a role play with that patient. Now, in this patient, it's telling you that they're a little bit annoyed. So you already know before you walk into that room that you're going to be dealing with somebody who's quite frustrated in a situation. So you're looking to demonstrate skills around how to handle anger, how to handle somebody who's frustrated, but also you've got to demonstrate your ability to score in those 3 areas. So you've got to score in data gathering. So how are you going to ask appropriate questions to build up scores for gathering data? You're going to be assessed on your management of the situation. So this is not just managing the clinical side of things, it's managing the non-clinical side of things as well. So for example, they might have told you that they're angry because they thought they were going home tomorrow because their job is suffering and they're not getting paid, and they're the only person who earns in the family, and they've got 3 children and they're stressed because of that. So you're not only managing the fact that you've got to do a clinical assessment, you're managing the fact that this person is stressed. You've got to talk about finances, you've got to talk about how can we support you from a stress point of view, and all those kind of things. And that's the overall management that you're looking for. Remember, PLAB 1 is testing your knowledge. Once you've cleared PLAB 1, they kind of assume that your medicine is now up to scratch. PLAB 2 is about, can you assess a situation and can you take that story forward? Can you manage the situation as a whole, which includes medicine, but other things as well? And a big mistake that I see in people who do PLAB 2 is they just learn more and more medicine and think that as long as I go into that exam and talk medicine, I'll pass. And it's a very different exam to ones that people have often done before because of this reason. So for example, the kind of things that we talk a lot about in PLAB 2 to make your overall case a well-rounded one is we talk a lot about the data gathering. So when people do a data gathering, or when they go and see a role player patient initially, they do a good clinical history. So in that case that we talked about, for example, they might ask a lot of questions about the pneumonia. They might ask about, are you coughing more? Have you got a higher fever? Are you bringing up any blood? Have things got worse? People do that bit very well because they're very good at the clinical questions. And red flags are something that we talk a lot about. So in this case, for example, red flags will be things that you can't afford to miss as a clinician. So has this person's cough got worse in the last hour? Have their fever got worse in the last hour? If you don't demonstrate the clinical questions are there, then your data gathering is going to obviously lack from a clinician point of view. But also we talk a lot about psychosocial in this exam. So, asking patients about who's at home with you, what's your support system? You seem very stressed. Who do you live with? Oh, I live with my wife. She's worried because she doesn't work. I'm working. All this story can only come out when you start to talk a bit about the person's background. Psychosocial means how does something in their life impact their medicine, or how does their medicine impact their life? For example, this is someone who's got a pneumonia. Does this person smoke, for example? Is that a thing that you need to be talking about as well when it comes around to the second half? So often in PLAB 2, people do a lot of work around the clinical stuff, and that's very important, but they miss things like the links between life and medicine. So when we talk about psychosocial, it's things like who's at home with you, what job do you smoke, do you drink alcohol, what are your stress levels like, and how do you de-stress? Do you drink too much caffeine? Do you sleep okay? Do you do exercise? What's your diet like? These things are all really important when you're assessing a patient as a whole in a holistic way, and PLAB 2 will look quite heavily on these kind of things as well. For example, this guy's got a pneumonia, but when you ask about jobs, you'll be saying stuff like, sometimes having coughs and infections can be caused by certain work environments. Can I ask what you do for a job? Maybe this person works in a dusty environment. Maybe this person works in a factory where there are lots of humid conditions that are leading to him getting infections. It's one thing to show that you can treat an infection, but it's another thing to go and show that you've assessed the situation as a whole, including things like risk factors, social environment, etc. So that's your psychosocial. And the third bit, so the top 3 boxes here are all what we talk about in terms of data gathering. We talk about 3 bubbles: red flags, psychosocial, and the third bubble that's very important for a PLAB 2 type exam is ICE. Now, I don't know if you guys have heard about ICE before. Just maybe let me know in the comments if you've heard about the term ICE before. It's essentially means ideas, concerns, expectations. So you're basically trying to understand what's going on in the patient's mind. Yes, fantastic. It's important to understand what's going on in the patient's mind, because the first half of a case like PLAB 2 is all about understanding issues. What issues do I need to understand as a clinician to be able to manage the situation properly? Now, there are clinical issues that you need to pick up through red flags. There are life issues that you need to pick up through psychosocial, and there are mind issues that you have to pick up through ICE. If you don't understand what's going on in that patient's mind, then you're going to find it hard to manage that situation. You're going to find it hard to make him less angry if you don't understand what's going on in his mind. So ideas, for those who don't know, are asking the patients ideas about the situation. So what do you know about pneumonia? What do you know about missing antibiotics? What do you know about the treatment of pneumonia? That is understanding somebody's basic ideas. And this person might be angry because his idea is, if I miss antibiotics for an hour, then that means my whole treatment is gone, and it means I'm not going to be going home tomorrow. That could be the idea that you're trying to understand, so that you can explain that to him in the second half. C is all about concerns. Is there anything particularly worrying you about all of this? We can't assume that this person is worried because of X, Y, Z. We need to ask this question: is there anything that's worrying you? Now, this person might be worried because he thinks he's not going to be able to work tomorrow again, and therefore his money system is going to go worse. He might be worried because this pneumonia might be an early sign of cancer. He might be worried that if he goes home too early, he might pass this bug on to his child. So we have to understand what's going on in his mind before we can manage the situation. And then E is expectations. What did this person expect from me as a clinician? Does he want, it could be as simple as, I want an antibiotic, or I want a pain relief, or I want a referral to a respiratory consultant. But it could equally be, doctor, I want some help in my finances. I want you to help me with the stress that I'm going through right now. So again, expectations is a very important thing. We may assume that this guy just wants antibiotics because that's what he's annoyed about. But unless we ask the questions about his mind, we don't assess the situation fully, and therefore we're not able to manage the situation properly. So PLAB 2 is an assessment that, yes, tests your medicine, but it also tests your ability to understand core issues that will relate to this situation. So that as a clinician, I can manage the situation as a whole. Now, data gathering is one thing you're marked on. The other thing that you're marked on, remember, is interpersonal skills. So interpersonal skills is essentially how well does the case flow? Is there a nice rapport between doctor and patient? Is there a good communication between the two? Are you able to handle the fact this person is angry? So we talk about 3 R's: reasoning, relevance, and reflection, to try and increase the interpersonal skills of a consultation. Reasoning, you guys may have been practicing things like signposting, for example. So we know why, as doctors, we're asking this person, do you have a fever? Are you coughing up blood? We understand that, but a patient does not understand where those questions are coming from. To them, they may be quite scared when you ask them, do you cough up any blood? So we have to reason it first. Mr. X, when it comes to having coughs, there are a couple of medical questions we like to ask just to make sure things are okay. Can I check, for example, do you cough up any blood? See the difference? The patient is now going to understand why that question has come, rather than suddenly, blood, why are you asking about blood? That's really scary. So we have to be conscious that, yes, we're asking questions, but we have to reason to a patient why these questions are coming. So if we don't do that, patients often get a little bit scared, and then they may worry, where did that question come from? The doctor's asking me irrelevant questions, and that's why reasoning is important. Relevance is particularly important when it comes to psychosocial. So I can ask this guy openly, Mr. X, do you smoke? Or Mr. X, what do you do for a job? But I need to be demonstrating that I understand the relevance of that question, and I need to be showing my patient that this is why I'm asking about this. It's not just a list of things that I've been told to tick off, that they're important questions. So you make it relevant. Mr. X, when it comes to people who have coughs, there are certain things can make it worse. Things like smoking, for example. Can I check if you do that? So that's very different to, Mr. X, do you smoke? See, that relevance is really important. Rather than just saying, what do you do for a job? You'd make it relevant. Mr. X, sometimes certain environments can make people cough more. Can I check what you do for a job? See, that's very different to, Mr. X, what do you do for a job? So these kind of skills are going to be assessed in PLAB 2, not just your ability to ask questions, but to do it in a way that's very patient-centered. And the third R is reflection. And this comes mainly when it comes to I. So if someone tells you a big worry, for example, it's important to reflect that back to show that I genuinely understood what you just said. Like, that makes a lot of sense to me. So if this guy goes, doctor, I'm really worried that if I don't go home tomorrow, I'm not going to be able to work for another day and I'm going to lose a lot of money. And that's a big thing that they've told you. So we've got to get used to reflecting that back. You know what, I can see why it's really worrying. And things financially, a lot of people are under pressure at the moment. So I do see why you worry about that. So you're just reflecting back that I understand why you said that. I'll answer it later. I'll help you later, but I'm reflecting it to show you that I genuinely wanted to understand that. If a person says an expectation, doctor, I wanted to have a CT scan. You may be thinking yes or no, but you don't need to say that yet. You just need to reflect that back. Yeah, you're right. I can see why you want a CT scan. Lots of people do have CT scans in this situation. It's that reflection of showing that I genuinely wanted to know what was in your mind, because for me as a clinician, that's important. So these 3 R's, we talk about the 3 Arora R's of interpersonal, reasoning, reflection, and relevance, are really important in exams like this to show that I am with my patient. I'm not just doing an exam, I'm with my patient, I'm having a conversation. And the third bit you're marked on is then the management plan. Now, the management plan doesn't just mean the clinical management plan. A big mistake that people make is they'll just talk about clinical things nonstop. But yes, you need to talk about clinical, but there are other things that you need to manage as well. So for example, in this case, you may be managing the fact that you're going to give him his antibiotics straight away because he's missed a dose. Yes. But also you might be managing the fact that he's stressed, and how can you help him with that? You might be managing the fact that he's got financial worries and signposting him to a financial organization. You might be managing the fact that he's worried that he might pass it on to his child and explain how that's not going to happen. Again, if you're not managing everything that you've understood in the first half, then you're not going to be scoring high in the management plan, because the management plan is not just clinical. It's not just what drug do you give, or what test do you arrange, or what referral do you do. That is part of it. But if you want to score the higher marks, you have to manage the other issues as well, the psychosocial issues, the fact that maybe do you want to discuss the smoking because that might help with your cough. Managing that, as well as just managing the worries. Then you start to think about getting higher scores in PLAB 2. So whenever you come around to preparing for PLAB 2, the OSCE based exam, it's not just about learning how to do a clinical history for backache or learning what the guidelines say for managing backache. It's about thinking, how do I assess the situation as a whole? And then how can I demonstrate to my examiner that I'm taking the story forward by managing it as a whole? And these kind of principles, when we teach for PLAB 2 and we do practice role playing, it's about learning these things, because the medicine generally by then is fine. People are okay. PLAB 2, it's this type of stuff that often can. So the quicker people understand this type of thing, and the quicker you start to do your preparation like this, the more chance you're going to have of passing the exam. Now, when it comes to PLAB 2 preparation, because it's a role play based exam, preparation is very different to PLAB 1. PLAB 1, you can almost do it on your own, go through the material, learn it all. PLAB 2 is different. PLAB 2 needs practice. It needs testing of role plays. It needs honing of skills. So just like any exam, start with a plan, know what's coming, know what type of assessments are coming, what type of scenarios are coming, understand the exam, how it's marked. Knowledge is a big part of it, but it should already be there because you've just passed PLAB 1. The knowledge bit should generally be quite good. You already are aware of the guidelines, you know the tests that need to be done, you know the questions that are important. That bit's fine already, but you still need to stay on top of it for PLAB 2. Technique is huge. How do you use your 8 minutes effectively to demonstrate as many skills as possible? That is a huge thing that needs a lot of practice. And when it comes to practice for PLAB 2, there are two main types. There are courses that you can attend and mock exams that you can do where you get focused, detailed feedback. But also you need to be practicing with colleagues and friends and study groups as well, so that you're constantly honing those skills. And the combination of those two usually leads to a better PLAB 2 score than someone who's just done one or the other. So PLAB 2 obviously is a little bit more in the distance than PLAB 1, but it's just useful to be aware of what type of assessment it is so that you can start to think about preparing for that at an earlier stage. So once you pass PLAB 1 and pass PLAB 2, then obviously you go into the realm of what Dr. Kimberly was talking about yesterday, the other things that you can then think about. So then you've got your license to practice in the UK by that stage, and then you have various options, whether you do a standalone job for 6 months just to get used to the NHS, whether you apply for the foundation program directly, whether you apply straight for specialty postgraduate training, orthopedics, core medicine, general practice, radiology, etc. If you're thinking about specialty training, if you think you're at that point where you want to go straight into postgraduate training, then the main decision that you need to make in the UK is, are you going for a GP approach, general practitioner approach, or are you going for a specialty approach? That's the first kind of major decision that people tend to make when it comes to the UK. If you choose a particular specialty, every specialty has a different application process. And I'm sure Dr. Kimberly went through the various specialties yesterday and talked about how they might differ. Some have interviews, some have an exam, for example. But a lot of specialties, there's 9 or 10 specialties currently use the MSRA exam as part of their assessment, if not all of their assessment. So for example, people applying for GP, psychiatry, surgical training, etc., now need to do the MSRA exam, the multi-specialty recruitment assessment. And I'm sure that's something that Dr. Kimberly talked about yesterday. But that will be the next exam after PLAB 2 for most people when you're thinking about your UK journey, depending on which specialty you're thinking about applying for. And if you need me to go into detail on that, I can go into detail on that in a bit more detail. So a few words on UKMLA then, because a lot of you guys will be thinking of this post 2024. So UKMLA will obviously be coming in then. We have some knowledge of UKMLA at the moment. We don't have a huge amount of knowledge. The GMC, the General Medical Council, haven't given us a huge amount yet, but they've given us enough to understand some core bits. So like I mentioned earlier, it's going to be the same exam now. So currently in the UK, anyone who trains in a UK medical school, once they've passed their clinical finals from that medical school and got their degree, they can apply directly for Foundation 1 training. There's no additional exam at the moment for UK trained medical students, but that will change in 2024, where, like I said, whether you qualify in the UK or you qualify abroad, you still need to take the same exam so that everybody starts at the same level playing field. 2024, like I said, is when it's going to be introduced. I think it will be late in 2024, because I think the plan will be that when the medical student year finishes, which is around August or September every year, I think that's probably when the first UKMLA will be, when the first batch of UK medical students finish in around August. But that's not confirmed yet, but I presume then, therefore, PLAB will change at that same point. We're guessing, we're not 100% sure. 2 papers, AKT, Applied Knowledge Test. This is almost going to be like the PLAB 1 exam in essence. It's going to be a multiple choice based exam, certain number of questions, and there's a certain pass mark. And I'm sure they will allow you to do it abroad, just like you can do PLAB 1 abroad. CPSA, Clinical and Professional Skills Assessment, is going to be an OSCE-based exam. So you can guess that it's going to be fairly similar to PLAB 2 in terms of there are a number of stations and you need to be demonstrating core skills. I don't think it's going to change too vastly because the things that are being tested in PLAB 1 and PLAB 2 now are core clinical skills. So I can't see they're going to change the core clinical skills that are going to be tested in the new format, but they're going to have new names. It's going to be a new world for everybody. But if you're preparing for PLAB 1 or preparing for AKT, I think the process will be the same. I don't think there's going to be too much difference. The fees for the exams are not announced by the GMC yet, but I can't see them being too different to PLAB. But again, we don't know that at this point. They haven't mentioned details yet, like, for example, how many attempts does somebody get? Like now we know for PLAB, you get 4 attempts for each exam. Whereas we don't know that for UKMLA, but again, I guess it will mirror it, but we don't know. And the GMC have released an MLA content map, which is basically telling you the skills, the knowledge, and the behaviors that they expect. And remember, the UKMLA is assessing you at a level down. So PLAB 2 is assessing you at the level of an FY2 doctor, whereas the UKMLA is assessing you at the level of an FY1 doctor, because medical students in the UK will go straight into FY1. So they have to assess you at that level. And therefore, the theory is that UKMLA may be a little bit easier than PLAB. But again, we just don't know enough yet. We haven't seen enough detail to know that. But that's what's coming, 2024. I wouldn't let it stress you too much. I see a lot of people worried about this new exam. In essence, I think it's going to be fairly similar. A common question that I get is, if I've already passed PLAB 1 and then they change the format, what happens to me? Do I need to go back to the beginning again and do AKT? And all the things that we're hearing is that, you know, if you pass PLAB 1, in essence, you don't have to take AKT because you've passed the equivalent and you'll move straight onto CPSA. But again, that hasn't come out as confirmed, but I can't see how, if you have thousands of doctors who've passed PLAB 1, they're suddenly going to say, right, all of you need to go back to AKT now because we've changed the system. I just logistically, I can't see that happening because of practical reasons. They need doctors in the UK. So you know, but that's not come out as mentioned yet, but I think that will probably be the way it's going to be. So whether you're preparing for PLAB 1 or PLAB 2 or UKMLA, then we talked about passive teaching earlier on, and we do a lot of passive teaching. We do a lot of courses, which we'll talk about in a second, but we do a lot of, we're really, really big on passive teaching. So for example, we do every Monday, we do a free teaching email that goes out to, you know, 8,000-9,000 doctors across the world. It's called Arora Weekly. If you just go onto our website, I don't know if you guys want me to bring up the website just to show you a bit about our things, but there's a bar at the top which just says join Arora Weekly. So you click on it, you put your email address in, you'll get an email which says, do you want to get these emails? And then once you click yes, every Monday we'll send you a quick teaching email. It's got kind of 5 quick clinical questions, short videos to teach you bits about consultation skills, and also all of our latest webinars and blogs are also on that email as well. So if that's something that might interest you, it's worth thinking about. We do lots of webinars on various topics. PLAB 1, PLAB 2, we do at least 4 times a year for each of them. MSRA, we do at least 4 webinars a year. And we also do conferences on careers, career options for various specialties as well. So, you know, these are all things that are there for you to take advantage of. Like we mentioned, the more awareness that you have, the better you feel in terms of preparation for when you come across these things. And we have a lot of videos on things like YouTube, and we teach a lot on Instagram as well. So those are things that we're really big on passive learning. It's something that we always do. But I'd encourage you to try and look at some of these. Do you want me to quickly show you on the website where these webinars are found and where the signups are? Yep, let me quickly show you that. So you can see at the top here, it says join Arora Weekly, our free weekly email. So that's where you click sign up here, put your email address, and you'll get the teaching there. And then there's a tab for free webinars. So when you click on the free webinars, you'll see all of our conferences, all of our free webinars are all here. So we've got a PLAB 2 one coming up. We've got a PLAB 1 webinar coming up, MSRA webinars. We have regular PLAB 2 role play practice on Zoom that you can sign up to. There's a lot of stuff that we do for free. So it's worth just staying on top of these. And if you get the email every Monday, these will all come out as well. So you'll know exactly what's coming up. So people asked a little bit earlier on about courses and resources. So I'll talk about our PLAB 1 resources first. So like I mentioned, a lot of people will get a question bank for PLAB 1. which is fine because you need to do lots of regular practice. But what we have done is come up with a kind of all-in-one package, really, that covers everything from a knowledge point of view, but also from a technique point of view as well. So we have something called a PLAB 1 Gold package, and that Gold package is a 12-month access package. So once you purchase the package, you get everything for 12 months and you can use it unlimited. It comes with a complete 20+ hour video course, so cardiovascular chapter, respiratory chapter, gastro chapter, and I teach you through all of the content, the guidelines, the knowledge, the investigations, everything you need to know from that point of view. It comes with 7 full PLAB 1 mock exams that you can do whenever you like. They're pretty challenging exams, but they're set in the same format as PLAB 1. They teach you in the same way as PLAB 1. It contains our audiobook course. Our audiobook course is used by quite a lot of people to buy time. So you just download this course to your phone and you can listen to it multiple times when you're traveling, when you're commuting. Again, it's split into different chapters: cardio, respiratory, gastro, etc. And you also get 2 sets of digital flashcards. We get our clinical UK guideline flashcards, the blue ones, and you get your pharmacology flashcards because pharmacology is a big part of PLAB 1 exam. So that's the PLAB 1 Gold package. And that gives you 12 months access, but we often increase it to another 3 or 4 months if people need it. We'd rather you start it early and get full value from it. So that's PLAB 1 Gold. And then when it comes to PLAB 2, we have something similar for PLAB 2 Gold. We've got a package that contains a video course, 2 different audiobook courses, 2 different sets of flashcards, more tailored to PLAB 2, and then a live role play course that you do virtually online with myself as well, closer to your exam. So that's your PLAB 2 package. But at this stage, if you're thinking about PLAB, then this is the one you'd be thinking about, PLAB 1 Gold, which, like I said, is 12 months access. So we'd rather people use it. You know, a lot of final year medical students, fourth year medical students get this because they know they can start to use it, A, for their finals, but also for PLAB whenever they come around to doing PLAB 1 as well. So on the website, when you can just drop down on PLAB 1 and you'll see all the options there, if that's something that might interest you going forward. So I've covered quite a bit there. I'm sorry if I went a little bit fast and went through things in a bit of detail. There's quite a bit to get through when it comes to PLAB and UKMLA. I hope this is the kind of thing that you were looking for, and I hope that it answered some of your questions. If you have any further questions, I'm happy to take them and try and clarify some bits that you might still have. But hopefully that was the kind of thing that you were looking for.
Thank you, Dr. Arora, for this amazing presentations. If anybody has any question, you can send them in the chat box, or you can also unmute yourself and speak to Dr. Arora directly.
And just while people are typing away, PLAB is a very passable exam. You know, there's a lot of people who don't sadly pass PLAB 1 and PLAB 2, but hopefully you've seen today, if you get your preparation right, if you understand technique and strategy, as well as just learning lots of material, then PLAB is a very passable exam. And you know, hopefully for you guys who do go on, the very fact that you're attending a course and a session like this shows that you're keen to understand things early on, which already tells me that you're in a very good position in terms of passing an exam like this, because it's the people who leave it too late, who kind of do it all in a rush. They're the ones who tend to struggle. But the fact that you guys are all here tells me that you should find it a very passable exam. Good. I'm just going to put a link to the various blogs and show you where all the blogs are as well. So you'll see up here, we've got a whole bunch of blogs up here. So there's blogs from doctors who have passed PLAB 1, doctors who have passed PLAB 2, how they've done it. But also if you just click, say, to PLAB 1, then you'll see there's a whole bunch of blogs here. What is UKMLA? What is PLAB 1? What is the PLAB exam? How to pass PLAB 1? What to do after your PLAB 1 exam? And then similarly, we've got it for PLAB 2. A little bit further down, these are all our PLAB 2 blogs. Again, by doctors who have passed PLAB 2 recently, but also general blogs about how to prepare, how to practice with study groups, how to practice with friends. And then we've got general blogs about working in the NHS. So let's scroll down. Yeah, working in the NHS. So how to open a bank account in the UK, how to get a clinical attachment, how to find your first job, the CREST form, all these kind of things that, again, you're going to be coming across at some point when you're thinking about your UK journey. So just bear in mind the blogs might be a good source of information. So I'll just put that link in the chat as well.
If you guys have any more questions, you can send them real quick, or else I think it's time to wrap up this event. So a big, massive thank you to Dr. Arora for sparing time to come and deliver this talk for us today. And also thank you to Dr. Kimberly Tan, who talked yesterday. Thank you to the organizing team for making this event a success. And a big thank you to everyone who stayed till the end. We, the Professional Committee of Fudan International Medical Students Organization, truly hope that you gain a lot from attending this event. And we do have a feedback form which will be posted in the Zoom chat box, and which will also be sent to you by email at the end of this talk, together with the recording of the event. So please do fill it out so that we can make our future events better for you. So this marks the end of the Silk Road to the UK Talk series, and we hope to see you again next time. Thank you, Dr. Arora.
Thank you. Thank you. Take care, guys. Bye.
Bye-bye.